All right, so today we're just going to be talking about gestational diabetes. This is Casey Pearson, a direct entry midwife with Moontree Midwifery. So, what is all the fuss about gestational diabetes? It's a term used in pregnancy that simply means a decreased glucose tolerance. So, it just means that your body is not able to handle sugar as well. The biggest risks of gestational diabetes is a big baby, over 8 pounds, 13 ounces, excessive amniotic fluid, fetal issues, induction and cesarean section, and then baby with blood sugar issues after they're born. So, what does this mean? The American College of Obstetrics and Gynecologists recommends screening every pregnant person with a non fasting 1 hour 50-gram glucose tolerance test. If they fail, they take the fasting 3 hour 100-gram glucose tolerance test. If they fail the 3 hour, they're put on a restrictive calorie diet low in carbs. 30% of babies to gestational diabetic parents will be macrosomic, so big babies, but 70% won't. And the ACOG wants us to treat everyone the same, regardless of their health and their history. Like, you are more at risk for having type 2 diabetes if you have a family history of type 2 diabetes. So, even if you don't have any of those risk factors, they still want to screen you for this. Gail Hart says that the primary risk of gestational diabetes is the label being called a gestational diabetic. Women placed on a restrictive calorie and low carbohydrate diet have a higher risk of pregnancy induced hypertension, preeclampsia, and preterm birth. Pregnancy induced hypertension is high blood pressure that is only happening in pregnancy. You don't have a history of high blood pressure. And the lab values are also a really big thing for this. Like, did you fail by a lot with your 50-gram test, or were you barely elevated? There is a massive difference between the two. So, the glucose tolerance test, most people will drink the 50-gram glucola drink, then have their blood drawn an hour later and find out if their body passed or failed. They are looking to see what your glucose level is when your blood is drawn after drinking this sugary drink. If you fail, so if your blood sugar is above a certain level, you have to fast, have your blood drawn, drink a 100 gram, so double the size, and have your blood drawn 1, 2, and 3 hours later. They compare they compare those values and see if you pass or fail. But they don't really let you know that there are other options. Like, they do have the option where you can eat 28 gummy bears or jelly beans or things like that, but they are specifically looking at glucose, and those don't really qualify. And so the other option, one of them, instead of drinking this drink, is a home glucometer. They're about $30, and taking your own blood glucose numbers for a week, fasting and after meals. That is a better indication of how your body is reacting to glucose during your pregnancy than drinking a drink that you wouldn't normally have foods during pregnancy. Exercise and be active. That could just mean be up and about. Don't sit all day, help your body work through all that glucose. So the question is gestational diabetes testing and the glucose tolerance test for everyone the answer foods during pregnancy? Exercise and be active. That could just mean be up and about. Don't sit all day, help your body work through all that glucose. So the question is gestational diabetes testing and the glucose tolerance test for everyone the answer? Many people have very different views on this. In a low risk pregnancy, especially if you're with a midwife, it isn't necessary a lot of the time. Like, having the glucose tolerance test, sure, go ahead. But also knowing that you have other options, and that the number, especially if it's just barely elevated, does not mean a whole lot for gestational diabetes and pregnancy. And you always have the option to get more information and understand the risks and benefit of every test that is run. You do not have to do this test if you do not feel comfortable with it. And also be aware, a lot of people will get really sick when they drink this drink. You have 5 minutes to drink it, and it is a lot of sugar. And It can make you feel a little nauseous, and just that's another thing just to be aware of. So you have options. This test may not be for everyone, or it may be. It just depends, but you do have other options.